Hey guys, welcome back to Yoga with Leona, your site for everything about yoga and breast cancer recovery. Today's video is going to be a little practical tutorial on a series of stretches that I think are great for my friends with lymphedema, or for those of you who are at a super high risk of lymphedema because of having had a lot of lymph nodes removed, or whatever your risk factors might be for lymphedema. So lymphedema is a big thing that scares a lot of us after going through breast cancer treatment. And so I thought I would speak to it a little bit directly today in terms of the best stretches and things that we can do in our yoga practice that'll help with that. All right, so if you haven't already watched the educational video entitled Yoga Asana in Breast Cancer, have a look at that. That's got a little bit more detailed sort of just discussion about what lymphedema is and why it happens, and the different things that we can do in our bodies to help minimize that risk. So there's more discussion in that video. Today's video is going to be more practical demonstration of the stretches that I recommend for you. So just as a very brief review of the things that I discussed in that video. So the ways that we can move our body to help lymphatic flow improve include a few things. So if you've ever been to a lymphedema therapist, which I recommend if you haven't done it, they always talk a lot about deep belly breathing or diaphragmatic breathing. And the reason is that deep diaphragmatic breathing, meaning breathing deeply down into our abdomen, really helps promote lymphatic flow. So it helps promote return of that lymphatic fluid from our arms. So deep belly breathing is a big part of treatment and prevention of lymphedema. So we're going to do a bunch of deep breathing today, and we're going to really work on coordinating our movements with that deep belly breathing. The second thing is muscle movement. So when we move our extremities and the muscles move, as those muscles move, they massage the adjacent tissues and they help to promote, again, that flow of lymphatic fluid back to the center. So holding your arm isolated and never moving the muscles is actually one of the worst things that you could do for lymphedema. So we're going to move our muscles. We're going to build strength and flexibility in our arms. We're going to breathe deeply. The next thing is that if you've ever seen a lymphedema therapist, you know that one of the things that they do is this massage therapy, where they stretch the skin, basically, because some of the lymphatic vessels lie just beneath the skin, and when they stretch and then release the skin, this helps to promote the movement of that fluid. So again, stretching our body and then releasing, stretching and releasing is going to stretch that skin as well as the muscles, and that's going to also promote movement or return of that lymphatic fluid. And then lastly, simple gravity. So we're going to do a lot of movements where we've got our arms up above our heads. And so the combination of all of these stretches together hopefully will help minimize lymphedema, help promote improvement of symptoms if you already have existing lymphedema, and hopefully prevent it for those of us who are at risk but haven't developed lymphedema yet. So let's make our way to a comfortable seat. So whatever that looks like to you, you can do these first stretches in a chair if that's more comfortable to you. I'm going to have a seat on a block, which I like to do, and that just kind of opens up our hips a little bit. So find your comfortable seat, whatever that looks like, and settle in. Come back to your breath. And as we start the stretches today, let's just visualize the energy moving around our body and fluid moving throughout our body without obstruction. So maybe visualize especially that arm in question, the side where you've had some lymph nodes interrupted. Let's just visualize energy and fluid moving into and out of that arm as we begin some stretches. So we're going to start with some deep breathing that's got arm movements associated with it. So it's really simple. So we're going to have a nice tall spine as we begin, and then you're going to inhale and stretch your arms up to the sky for 2, 3, 4, and then exhale, sweep the arms down to your sides, 3 and 4. Inhale, stretch them up, 2, 3, 4. Big stretch at the top, and then exhale, down, 2, 3, 4. Keep going like that. Now, as you're breathing, make sure you're taking the biggest breath in that you can. Feel the breath come all the way down into your abdomen, and then exhale, 2, 3, 4. Keep going. Inhale deeply. Breath coming all the way down into that belly. And then as you exhale, pulling the belly back toward your spine to push the air up and out of your lungs. One more like this. Inhale up, really stretch those arms. And exhale as the arms come down along your sides. All right. Now, some of us, especially if we already have existing lymphedema, that arm may be heavy, or the range of motion of that shoulder may be a little bit limited. And if that's the case, you just go as far as feels comfortable to you. Maybe your stretch only comes to here, and that's where you go. Now, you want to keep some symmetry in your body. So if this arm is your lymphedema arm, you don't want to bring it to here and stretch the other one up. Then you're just going to exacerbate any kind of asymmetry that you have. So you want to balance the two sides to wherever your limit is on that lymphedema side. All right? So never going to pain in yoga, as I always say, only going to where we feel a nice stretch. All right, let's take some more breathing. This time, as we exhale and bring the arms down, we're going to twist to one side and then the other. All right, so get ready again, and inhale, stretch your arms up for 2, 3, 4. Exhale, twist your body gently to the side as the arms come down. 2, 3, 4. Back to center. Inhale, stretch it up. 2, 3, 4. And exhale, gentle twist. Bring the arms down. 2, 3, 4. 2 more on each side. Inhale, stretch it up. Exhale, twist left. Inhale, stretch it up. Exhale, twist right. 1 more on each side. Inhale, stretch it up. Exhale, twist. Inhale, stretch it up. Exhale, twist. Good. Coming back to center. So you can see that just doing some of these very simple movements with our arms is going to build strength in our shoulders and our arms. So we don't have to do a ton of push-ups or weight into the arms to start building that strength and flexibility in the arms. That's really going to help us with our lymphedema. All right, this next one's called a teapot. You're going to inhale, stretch your arms up again. And then on the exhale, the left hand comes to the floor, right hand behind your head, and really stretch that right elbow up to the sky. Feel your right side body stretch. Good. Inhale, stretch to the top. And exhale, the other side. Right hand to the floor, left hand behind your head, left elbow stretches up. Good. Inhale, stretch to the sky. Exhale, left hand down, right elbow up. Feel your right side stretch. Inhale up. Exhale, right hand down, left elbow stretches up. Feel the left side stretch. Good. 3 more on each side. Inhale. Exhale, stretch to your left. Inhale up. Exhale, stretch to the right. So you can feel that side body stretching. And as you know, we've got lymphatic fluid return through that side of our chest wall. And this is an area that we can get into trouble with sometimes after surgery. Promoting this nice big stretch through that area will help promote fluid moving back to the center of our body, which is where we need it to go. Last one here. Right hand down, left elbow stretches up. Inhale up and release your arms. Good. Stop and breathe a moment. Just notice the sensation of your breath. Notice if your lungs feel nice and open. You've done all this big, deep breathing. We're going to keep doing some more of that, but just see how that feels to you. And again, visualize energy and fluid moving freely through your body. No obstructions. All right. Excellent. So Next, we're going to take a seated version of cat-cow. So you may remember cat-cow where we normally get into a tabletop position and we arch our back and then flex the back. So we're alternately stretching our back forward and then back. But we're going to take that in a seated position, again with some arm movements and again coordinating with our breath. So you're going to take your arms out to your sides, palms face forward. On an inhale, stick your chest out, arch your back slightly. And then on an exhale, cross your arms, give yourself a big hug, arch your back toward the back wall. Now inhale, chest out, arms extend. Exhale, push your spine back, cross the arms the other direction. Inhale, open your chest. Exhale, pay attention to which arm you're putting on the top and alternate with each breath. Inhale, open. Exhale, other arm on top, hug yourself. Inhale, open. Exhale, close. Inhale, open. Exhale, close. 2 more on each side. Inhale, open. Exhale. In this one, as you're bending your spine forward and back, you're also stretching the front side of your chest. So opening up those pectoralis muscles and all that skin on the front of our chest that can get so tight from treatment. Last one here. Inhale. Exhale. Good, and then inhale, open, and rest your arms a moment. So you might be starting to feel this into your arms, right? It looks like pretty simple movements, but we really can build strength. And as I said, flexibility, which are the best things that we can do for ourselves in terms of lymphedema. All right, a couple deep breaths here, and then we're going to come up to a stand for a few more stretches, and then we'll come back to the floor for the ending. All right, make your way up to a stand, however that works for you. And you can go ahead and move your blocks out of the way. We won't need them for the standing poses. All right, good. When you get up to a stand, you take a gentle back bend if that feels good to you after sitting down. Sometimes we need to shake it out a little bit. Good. All right, now let's come to goddess pose. So for goddess pose, we're going to take our feet wide. So a little wider than the hips if that's okay for you. And then the toes are going to point out to about 45 degrees. So the feet are not parallel, toes are pointing out in this one. If you can take the feet wider, that's fine too. So you can see my feet a little bit wider than my hips, toes pointing out to 45 degrees. Now we're going to inhale, stretch our arms up to the sky, and then exhale as you sit your hips down, arms come down into a cactus. Inhale, stretch the arms up. Exhale, sit it down. So your spine is nice and straight. You can see you're not tilting forward or pitching forward, but sink straight down, spine is straight. Inhale up, exhale, sit it down. This time we're going to stay down. Now if you need to straighten the legs and come back up because your quads get tired, no problem. But if you can stay here, let's strengthen our legs while we're at it. So arms are in a cactus. Now we're going to take what we call cactus claps. So inhale, open your arms. Exhale, bring the right hand over to meet the left. Inhale, open. Exhale, take the other side. Left hand meets the right. Inhale, open. Exhale, clap. Inhale, open. Exhale, clap. 2 more on each side. Inhale. Exhale. Inhale. Exhale. 1 more on each side. Inhale. Exhale, inhale, exhale. Inhale, open, and let's stand up. Let those quads rest for a second. And feel really all of this energy and stretching through your chest. Getting an awesome stretch and strengthening through those arms and shoulders. All right, 1 more stretch here. Now again, I'm going to offer you legs bent in goddess pose, or if your thighs are getting pretty tired, you can keep them straight. All right, so inhale, stretch your arms up to the sky, and exhale, sit it down. Now bring your arms out to the sides, and on an inhale, you're going to stretch the right arm up and over. Exhale, back to the center. Inhale, stretch the left arm up and over. exhale, center. Inhale, exhale. Inhale, exhale. And again, if your legs are straight, totally fine. Just do the same thing here. Inhale, exhale. Inhale, exhale. One more on each side. Inhale, exhale. Inhale, exhale. Good. Straighten your legs if they were bent. You can go ahead and bring the feet together. And again, shake it out. Let's roll our shoulders a little bit. I like to interlace my hands behind. Roll those shoulders back. Really open that chest. Again, opening up everything on the front side of your body. All right. Good. So let's come to face toward the front of your mat. And we're going to just step back into warrior one for this one. So you just step your left foot gently behind you. And the back toes are going to be out at about 10 or 20 degrees. Your hips face the front of your mat. The front knee bends and the front knee is just above the ankle. Now, first we're going to bring our arms into a cactus. So I'll show you what it looks like from the side. You know cactus arms. Now, again, we're going to inhale, open your chest, arch your back slightly. Exhale, bring the hands to meet in front. Inhale, open. Exhale, close. Inhale, open. Exhale, close. Two more. Inhale, open. Exhale. Last one. Inhale and exhale. Now the arms are going to come up in front of your face. So arms are bent at the elbow, just in front of your face. Now on an inhale, we're going to straighten the front leg and stretch the arms up to the sky. Inhale. Exhale, bend the knee, elbows bend again. Inhale, stretch it up. Thumbs point to the back wall. Exhale. Again, if your arms don't go all the way straight, no problem. You go to where you feel a stretch, and then you bend them again. Two more times. Inhale up. Exhale. Make sure your breath is deep. Inhale. Exhale. Good. Now hands to your heart. Step the feet to meet. And stop and rest a moment. And we're going to take the other foot back and do the same thing again. So feel your breath. Body nice and relaxed. Again, visualize energy and fluid moving freely through your body. All right, step the right foot back this time, coming to warrior one. So again, back toes out at just 10 or 20 degrees. Front knee is bent. Hips point toward the front of your mat. Arms into a cactus. Looks like this. Chest faces the front. Inhale, open your chest. Stick that chest out. Exhale, close the arms. Suck your belly in. Inhale, open. Exhale, belly pulls back toward your spine. Three more. Inhale, open. Exhale, close. Inhale. Exhale. Last one. Inhale. Exhale. All right, now arms come up in front of you, elbows are bent, and we're going to straighten the leg. Inhale, stretch the arms up. Exhale, bend it, elbows bend again. Inhale, stretch it up. Exhale, elbows down. Inhale, stretch up. Exhale, bend the knee, elbows in front of you. Two more. Inhale up. Exhale, bend. Inhale up. Exhale, bend. Hands to your heart. Step it forward and breathe. So you can notice all of these movements, we're taking big, deep diaphragmatic breaths. So every time that diaphragm moves up and down, it's massaging your thoracic duct. It's pulling fluid back from your extremities into the central circulation. So good for us. All of these movements, opening and closing, stretching and releasing, are getting our bodies strong and flexible, and they're also stretching the skin and muscles to promote that return of fluid to our central circulation. All right, let's make our way back onto the floor. Couple postures left, and then we're going to be done. All right, so go ahead and make your way onto the floor. We're going to come to lie on our backs. So make your way onto your back. Rest there a moment. If it feels good to you to windshield wipe the knees side to side, you can go ahead and do that. That always feels so good to me, to my low back and hips. I love that. All right, and then when you're ready, bring your feet flat to the floor, knees are pointing toward the ceiling, and we're going to take some bridge rolls. So on an inhale, you're going to push your hips up as you raise the arms up above your head, gently pushing hips up. Exhale, lower your arms back as the hips come down to the floor. Keep going. Inhale, hips up, arms up. Exhale, arms back to the floor. 3 more. Inhale up. Exhale, roll it down. Inhale up. Exhale down. One more time. Inhale up. And exhale down. All right, if you like those and they feel good, you can always take more of them. We'll just stop at 5 for today. The last posture is going to be a nice juicy twist. So you're going to take your arms out to the sides. Now, if you have a real heavy lymphedema arm and you've got a lot of tightness across your chest, it might be uncomfortable for you to have the arm all the way on the floor. So you might need to take a block or a blanket or a pillow and prop your arm accordingly. So I remember when I first was healing from my mastectomy, I had such tightness across my chest that I couldn't lie with my arms straight out like this. I had to have a blanket and I had to bend my elbow a little bit. So you do whatever you need to do. You want to feel a stretch, but certainly no pain. All right, so arms are straight out to the sides or as close to that as you can do. Feet are going to come to the wide edges of your mat, and you're going to let the knees fall gently to the left. As you turn your gaze to the right, you're going to feel a big twist and a stretch across the right chest, down into the right abdomen and into the right hip. So this is stretching that right front side of your body. If it feels good to you and you want more stretch, you can take the right arm up and to a diagonal a little bit and get a little more stretch through that right chest. You can also take the left foot on top of your right knee, and that adds to that juicy twist. A little leverage on the knee. So breathe deeply here in this twist. Feel your body relax. Feel the skin and muscles stretching on the front side of the right side of your body. All right, very nice. Release that side and come back to center, and we'll take the other side. Knees fall to the right as your gaze goes left. And if you feel up to it, you can stretch that left arm up into the corner to get a little more stretch through that left chest. You can put the right ankle over the left knee and really get into that left hip. And again, feel a big stretch through your left chest wall, left side body, and breathe. Again, always propping the arms or lessening the stretch if you need to. Making it comfortable, but feeling a nice, delicious stretch. All right, very nice. Release that side and make your way to a comfortable position just for a minute or so of Savasana. So your body comes to lie flat on the floor, toes roll open, arms are a few inches away from your sides. Just rest here a moment. Allow all that energy to settle in from the stretching and movement that you did. I'm going to come up to a seat. So you can stay here in Savasana as long as you have time. Feel your body really relax and allow all those benefits to soak in. So you can use these stretches, any of them alone or all of them in a row, in addition to your usual yoga practice or in place of your usual yoga practice. If you don't have time for a full asana practice, you can just do these stretches, or you can alternate them maybe on different days. But remember, the key for lymphedema is deep abdominal breathing, building strength and flexibility in the arms, using gravity and using that stretch of the skin and muscles to get that fluid moving again. Now you'll notice that I didn't do any postures today with weight into our arms. That's not to say that you can't do those if you have lymphedema or you're at risk of lymphedema, but my recommendation would be to work on these sorts of poses first. So the poses where you're not putting a lot of weight into your arms. After a couple of months or maybe a few months of doing those, if you're feeling good and the arm is feeling good, no problems with the lymphedema, then you could start slowly putting a little bit of weight into the arms. So at first, very little weight, like just tabletop here, and working to stretch the arms in that sort of position. And then eventually, very slowly working little bits of weight in the arms. So just like one breath in downward facing dog, and then resting. So if you have lymphedema or you're at risk of lymphedema, you just have to work into it very, very slowly. It's not to say that you can't do those poses, but be careful and go slowly. Give your body time to see if it's going to adjust and go like that. All right, so that's been our practical sequence for lymphedema. Please feel free to shoot me any messages, questions that you might have. I hope it helps, and really happy to have you all here with us at Yoga with Leona. All right, thank you for giving yourself this beautiful gift of yoga. Namaste.